And what I'd like to show you now is how to sell snowed Eskimos. This is the marketing component of the program. And I'm more of a practical, hands-on kind of guy. So what I've done is taken this as an example. If you were trying to drum up business for your practice, how would you do it? And the first thing we have to do is look at the regulatory framework in which marketing exists. And probably at this point, I should, as I get into the Stark laws, Pete Stark, famous congressman from California who has recently retired, has a whole series of laws. The physicians in the room will remember him from the jurisprudence test that you took. Probably half of that test is all attributable to Pete Stark. But in this section and in all our sections, we really thought that the legal dimension was so pertinent that we couldn't just have it alone as a standalone unit. So our staff attorney for the program, Ms. Ernestine Taylor, will be doing an interface with each one of our sections and present the legal perspective as we present each one of our topics. So we will do a tag team approach and not only tell you, like in this case, about medical marketing, but also if we were in class, she would be the one discussing the Stark laws. So this is a unique program in that we have a real attorney, Columbia-trained attorney, that will be providing the legal perspective in each one of our sections. And that's a really unique facet of the program and different from all others available to you today. So I just think it's such a neat thing that I wanted to plug it in my section. But the Stark laws are very significant because they govern how you can refer to one another or to yourself, and who can refer and how they can refer, and when it's illegal and when there's a safe harbor. And all of those are very complicated terms that I'm sure Ms. Taylor will explain in detail. Got away with that one, huh? Self-referral laws also. Again, there's some things, some types of services you can refer to yourself. Laboratory, for example. You can refer to your own lab. You have a lab, you can refer to it. But if three doctors get together, set up a lab over on Limburg Avenue, and everyone refers their patients there, and then split the proceeds, that's illegal. So we first have to understand what's legal, what's illegal within the marketing realm. What's a self-refer and what is not a self-refer. Then we get into the safe harbors that exist, and we get into the efforts of the Office of the Inspector General. The OIG is both at a federal level and a state level, and we talk about how they regulate marketing activities. Right now in Austin, Senate Bill 8, there's actually Section 14 has a gag order. It basically says that no provider can tell a Medicaid recipient what services they can qualify for. The state has their own eligibility workers that take care of that, and they don't want providers doing that. Well, what are they really doing? They're saying, we want to lower utilization by keeping people in the dark. So the regulatory facets play a very important role in marketing. Medicaid Fraud and Abuse Unit, or MAFUCO, was set up by the 1997 legislature, which basically is a internal Health and Human Services Commission department that investigates only Medicaid utilization and issues of fraud and abuse within the Health and Human Services or within the Medicaid providers of the state of Texas. And of course, we have Regional Accountability Contractors, or the RAC, and they're more specific for Medicare in terms of home health agencies, but they're also involved with other provider types. We have the HEAT. The HEAT is on. The HEAT is the Health Care Enforcement Accountability Team, and this is collaborative effort between the federal Office of Inspector General, the State Office of Inspector General, the Mafuco people, the local district attorney, and typically a court investigator, FBI, that's assigned to the federal case, and they all work as a team to investigate allegations of fraud and abuse. Probably the most significant thing that happened in the last year or so is what is a credible allegation. Because the CMS has basically said if there's a credible allegation against you, the OIG can put you on vendor hold and basically hold all of your cash flow until such time that the government either determines that you are innocent or you are guilty. And it's a specific issue right now in Texas because there's a number of doctors that have been put on vendor hold, Carousel Pediatrics, for example, in Central Texas, and they were put on vendor hold until they went bankrupt. And we're talking about 45 physicians, 25 dentists, about a $70, $80 million a year operation, put on vendor hold until they went bankrupt. So these are very real situations. Oh, and to this day, no one has figured out why they were on vendor hold. The Texas Medical Association had 3 experts look at their billing information, 2 from Texas, 1 from out of Texas, Oklahoma, I believe. They could find no wrongdoing in the billings. And the OIG has not been forthcoming in terms of letting these physicians know what they did wrong. But now they're out of business. They've actually gone bankrupt. So it's a big issue. Texas Medical Association is very much on top of this. And, of course, we have laws of supply and demand, and we have the 4 Ps. Laws of supply and demand, it's basically what people will pay for a service. The more there is of that service or good, the less they'll pay. The least there is, the more they'll pay. The story I tell here is the Power Rangers. I remember when I was a young man and I had a young child. I had a child that wanted a Power Ranger for Christmas. And by golly, I looked and looked, and there were no Power Rangers. They flew off the shelves at Toys R Us. They didn't have them in any major toy stores. The only place I could find them was in La Pulga. But in La Pulga, they were like $100, which was about twice as much or maybe 3 times as much as they really were worth at the store. But they were in so much demand that this guy paid $100 for that Power Ranger because he had to come home with a Power Ranger for the kid. Supply and demand. The more supply, the least the cost. The least supply, the more the cost. The 4 Ps, these are the 4 principal core columns of marketing. We have price. What's the price of the good or the service? What is the promotion? How do you promote that product? There is the placement. Product, price, placement, promotion of that product. And basically each one of those we will study in detail until you are an expert in the 4 Ps. And to exemplify what we're doing, let's say you're a plastic surgery practice. You're in plastics, and what you want to do is you want to attract more women with big ears, okay? How would you go about doing this? This is the audience participation part of the show. Please, don't be bashful, don't be shy, speak right up. Dr. Cortez, what would you do? Pardon me? You would advertise, okay? The before and after results, kind of like bariatrics. Dr. Ramirez, what would you think would be a good approach here?
Well, if I were a plastic surgeon, advertising the quality of my skin.
Okay, so your focus would be more internally on the doctor, on the skill set, the training the doctor received, and cosmetic or plastic surgery, where he trained, how good he was, and board certified, and everything else that would breed a sense of confidence in that physician. Okay? Dr. Ortiz, what do you think? Both of those. Okay? Ma'am, would you care to chime in? Okay, so you're looking at quality control so that when you have a satisfied patient, the word of mouth spreads as to how good the practice is, and that'll drum up business. Okay, all those are the right answer. All those are correct. But let's say, because we're dealing with ears, and we have a plastics guy in the room here, we're dealing with ears, so I'm thinking we ought to use the radio. Right? Get it? Get the connection? So we're gonna market to women with large ears, but we're going to use a multimedia approach, and that would be radio. As we look at radio, how do we go about putting a radio ad? You have a practice. You want to buy an ad. Why do you want to buy an ad? Why do you want to advertise on radio? Number one, your budget. What's a full page cost in the monitor? Well, if it's color, you're correct. If it's black and white, $1,800. Now, most women do not listen to KRUV radio, but there's more men in the room than women. What do you think a 30-second spot on KRUV radio runs? What would you say? $100? $200? $50. You can get a 30-second spot on KRUV radio during the morning drive or afternoon drive. That's from 6 in the morning to 9 in the morning, or 4 in the afternoon to 6 in the afternoon for $50. Okay? So would you rather spend $1,800 on one page in the monitor, or would you rather have 18 radio spots on the radio for the same amount of money? Radio? Right? Bless you. So the first thing you have to do is establish your budget, because you don't want some slick media person coming in and talking you into spending $50,000 a month on the radio. So you have your budget. So when that person walks in there, you know exactly how much you have to spend. You identify your target population. Who's our target population? Women with big ears, but this one has small ears. Okay, so we have that population identified, and that's a demographic we are chasing, okay? And when we chase that demographic, we want to have a ad topic that'll reach that population. And our ad topic is about aesthetics. It's how people look. And this is where we get into this dynamic of, do we want to promote the physician, or do we want to promote the service to the patient? And I would argue that this is a two-step process. First, you want to have an image campaign where you establish who you are and what you're about. And I think that takes care of Dr. Ramirez's concern about the quality of who's providing the service. I think you need to do that initially, right out of the box. Who am I? What is my training? What have I done? What can I do for you? Number two, what we want to do is we want to identify with the potential patient to be able to come in for that service. So if you're all into me, you're not going to reach you. So when it comes to the patient, you have to intersect the patient with their concern and your ability. So what I would think of an ad is probably having someone who was self-conscious, who felt embarrassed because of their ears, who always had to wear the hair down, could never wear it up, like our attorney here, would always have to wear it down and hide the ears and not wear earrings for fear of embarrassment and things like that. Something along those lines, patient-orientated, with a call to action at the end of the ad. So you say all these things. Are you self-conscious? Have you ever found yourself in this situation? Because you want the potential patient to identify with what you're saying. Then, at the end of the ad, you have a call to action. Call now. Call this number. There's someone waiting for you to call. Call, and we can help you with this process. We can put you in contact with the most competent person in the marketplace. Call now. There's people waiting. Call. You ever hear that? Call to action. No discount. Call to action. Okay, we identify the ad topic, and that we create our commercial, our creative, and then we identify the time of the year. Why do we want to know the time of the year? Where are people in the winter? In the house. It's cold outside, okay? Or they're in the car. In the summertime, people spend about 60% of their time where? Outside. If they're outside, are they going to be listening to the radio? Well, maybe, maybe not. You want to get the people that are listening to the radio. What's the best time to capture someone listening to the radio? Commuting. When they're driving. That's why we call it the morning drive and the afternoon drive. When people drive to work or when they drive home. You have a captive audience, they're in their car, they're stuck in a traffic jam, and the only thing they can do is hear your ad. Okay? So that's why we want to, what time of the year it is, what time of the day we want. Now we review the Arbitron rating. What's Arbitron? Anyone here ever hear of Arbitron? Has anyone ever hear of Nielsen? The Nielsen ratings, okay? Nielsen captures how many viewers there are per household, per TV channel at a given time. Arbitron does the same thing for radio. They measure how many households are listening to that station, how many people, and they measure the cost per point, which is something that will be very important to us in a little bit. But Arbitron tells you what station has the greatest market share for the demographic you're chasing. You want to know how many women, let's say 24 to 64 years of age, listen to the station. And what station would you think here in the Rio Grande Valley has the lion's share of women 24 to 64 years of age? No one listens to the radio?
Not that station,
Now,
no.
and this is where most people make their mistake. Because I like KVLY, or because I like B104, or because I like, pardon me? KMBH, okay? Maybe. Or 101.5, you know. Those are not the stations that command market share. In the Rio Grande Valley, the station that has the greatest market share is 102.5, La Ley. And this is all Tex-Mex music, and it is the most popular station in the Rio Grande Valley. Not really the station for most people in this room. I'm sure some of us have heard it from time to time, but it's not the most popular station among the educated people. But among women, 24 to 64 years of age, number one. They have about a 10 to 18% market share depending on the time of the day. 10% of the women in the Rio Grande Valley. Do you know how many that is? Population, 1 million. Half women, half men. That's 500,000 people. 10% of that is how many? 50,000 people. 50,000 women are listening to this station at almost any given hour of the day. Powerful. You want to market your ear surgery? La Ley. Okay? So you find the market share, the radio station with the greatest market share. You select your day part based on what you did. You want to get people driving in their car, and then you complete the media buy. You then can reach a great audience. Can you hear me now? Okay? For a very successful practice with all the ears that you could work with, okay? But this is how I would work at teaching a physician or practice manager how to do a radio media buy. And I would take you the same process with a newspaper, with a TV, with a brochure, with your whole marketing concept, image, campaign, that sort of thing. Also internal marketing, external marketing, and basically give you the mindset that the best marketer for your practice has to be you. There should be no better marketer than the physician themselves, because no one can market themselves better than the doctor. As Dr. Ramita said, that's the person that's providing the quality. This woman over here also said that the word of mouth will spread, but we have to do it within the concept of marketing, internal marketing, external marketing. That's what's happening. That dynamic is happening, and you're promoting yourself, you're promoting your practice. Thank you so much.